Is it dangerous or problematic? That's the question. So with diastasis recti, it can be problematic and cannot be. If you've strengthened and toned and you've gotten everything nice and tight, it cannot be a problem. I still have a little bit of diastasis left, but my core is nice and tight again. The problem that I had with it before I started doing the right exercises is I had a lot of back pain. I actually pinched a nerve and it was really debilitating. I don't know if anybody here has pinched a nerve, but it feels like the worst thing ever. You cannot even stand up. In my free exercises that are there in the links in my bio and mommymango.com, those exercises that I have for you, let me explain what they do and why they're so effective at shrinking the waistline down and making everything nice and tight. Was sitting on the toilet one day and I reached back. This was after I had my second baby, and I was maybe about, I don't know, 7 months postpartum, 6 months postpartum, or something like that. I turned around, and then when I came back around while I'm sitting on the toilet, my back literally froze. I was just like, oh. And I tried to get up and I couldn't. I was like, oh no, like I cannot stand up. Like what just happened? I literally crawled out of the bathroom, and long story short, I was in like serious pain that whole day. I think maybe it was the very next day I went to my chiropractor, who also there was a physical therapist in that office, and they assessed me and they said, you pinched a nerve. And I was like, okay, how did that happen? And they were like, your core is so weak that you had no support in the back to really stabilize your spine, and that can make you have back pain. Does anybody on here have back pain? Now, I'm answering this question because somebody asked me, is this dangerous or potentially like harmful? Does anyone here have back pain? Anybody here have back pain accompanied with the mommy tummy? If you do, this is a large part why. So what my physical therapist said was that you need to strengthen your core. You have to have a tight core to stabilize your back. So for those of you who are watching and you're thinking like, I don't care, I accept my mommy tummy, I love my mommy tummy, that's great. It's wonderful. Like I have stretch marks, I have loose skin, but I had to bring my tummy back in and make it tight for my back. For my back. Yes, somebody said, I have severe back pain. Yes. Danielle, back pain. Yes. Natural Me LC. Hey, Natural Me LC. We're like Instagram friends too. Yes. User 954. Yes. I think I have this, but I'm not a mommy. Yes, that can very well be. I just was talking about that. Natural Me is you don't have to be a mommy to have it. Even guys have it. I just talk to mommies more so because that's, what I identify with. And then it's more common with us as mommies, but anybody can have it. I have a herniated disc. Yes, as exoplanet. Nyamity, yes. Denise, yes. Phoenix, yes. Okay, so Phoenix, we're all saying that, okay, there's so many of us who are experiencing back pain. Now let me explain why we have this back pain. So that's why when I talk about like, if you watch my channel, sometimes I say, oh, you want to shrink your mommy tummy and, slim your mommy tummy. Yes, I mean, there are aesthetic reasons for wanting to have a tighter mommy tummy, and there's nothing wrong with that. There's nothing wrong if we feel more comfortable with having a tighter tummy. However, it's not just an aesthetic issue, it's also a very functional issue. And this is one of the functional issues that we can have if we have a looser mommy tummy. This is what happens. When we have here are our core muscles. Oftentimes we pay attention to the rectus abdominis because that's where we get our six-pack, ab lines look. We have the external obliques there. You see that there? Underneath inside, the most innermost muscle is your transverse abdominis. Your transverse abdominis muscle, like these muscles run up and down. The external obliques kind of run in like this. The internal obliques kind of run down like this. And the transverse abdominis literally wraps around your waistline and cinches your waist in like a waist trainer, okay? That's the muscle that we work on in my exercises, not only because it cinches your waistline in, but listen to me. If that muscle wraps all the way around from the front to the back, what is that doing for your back? It's supporting it, but it's from the front to the back. It's kind of an organic whole. You have to, as you're shrinking the mommy tummy, what it's doing is that muscle literally pulls you in all the way around, and it helps to support your back. Isn't that something? It kind of looks like this back brace. So this is a back brace that you could get in a physical therapist's office. Actually, when I pinched my nerve, I had to wear something like this just to sit upright. And I remember the physical therapist or the chiropractor, probably the physical therapist, was like, your transverse abdominis is like this back support. It literally holds you in all the way around and supports your back. So what happens when you have a loose mommy tummy? That transverse abdominis is often very loose. So if you have it hanging out here and it's not very tight, then you don't have the back support you need. Imagine if you said, hey, I need some back support, and I gave you a back brace like this that was too big for you. Would it support you? Yes or no? Would it support you? Yes or no? I want to hear it. Thank you for the roses and thank you for the likes. It lets the algorithm know that we're talking about something that's really beneficial or that people are appreciating. So thank you so much. I see that. Does that make sense? No. Thank you. Thank you. Thank you, Michelle. Thank you. List, thank you. AJ, thank you. Okay, Meredith, thank you. S, thank you. You guys are connecting that now, right? If it's hanging out like this, then you don't have the support that you need. You need a back brace that's nice and tight so that can hold your back in. This is in part why we have back problems. And this is in part why, as we age as females, we tend to have the most issues with lower back problems. And now I wonder if it's because a lot of us have diastasis recti, stretched out cores, and we don't remedy them because, for whatever reason, whether we don't know how, whether we don't think it's a big deal, whether we're just not connecting. I mean, there are other reasons why we may also have back pain that could stem from not having this tight core. So if you don't have a tight core, other things also happen. So like, look at my back brace. Now let's pretend like this is your transverse abdominis muscle, which is your deepest core muscle, wraps around your waistline. It cinches you in, okay? Your transverse abdominis, I do this talk on the best waist trainer, and the best waist trainer you can wear is your own. Tighten it up and then wear it, because that's what helps to hold you in. Okay, if you have a loose core, other things can also happen because this, like when you put on a back brace, it helps you to feel like you can stand upright, right? Because when I pinched the nerve in my back because of my weak core and my diastasis recti, I literally could not stand up. Like I couldn't hold my baby. I had to stay at a friend's house to help me with my baby because my husband was at work. It was just such an annoying thing, And when the physical therapist gave me the back brace, I literally could stand up. I was like, whoa, he's like, that's what your transverse abdominis is supposed to do. Essentially, that's what he said. And that's what happens when your transverse abdominis is strong. You feel strong to sit up. It's actually a postural muscle that helps to keep your core nice and tight, helps to hold everything in, supports your back, and helps you to sit up straight. And that's why I couldn't sit up straight, because I had pinched that nerve and everything was all messed up and whacked out. But either way, when you have that instability here in your core, other parts of your body have to overcompensate. So that's why some of you might experience pain in your hips, in your pelvis region, and other parts of your back, not just your lower back, but maybe even your mid or upper back. But it can start to make things go out of whack. Okay, so if you don't have that deep core strength that you so desperately need to keep you stable, other things will start to overcompensate, and we could have pain and feelings of dysfunction in other areas because this is our support system. Okay, so it has to be tight. So, I say all this to say that some of the issues that we have, mommy issues that we have, mommy body issues, are stemming from our lack of that core tightness. Okay, so I say this because a lot of times my TikToks are very short and they can seem superficial because I'm like, shrink your tummy, or I say tighten your abs or tighten your tummy or getting your body back or feeling, because we should be able to function without pain as mommies postpartum. And if we're experiencing pain, like I haven't even talked about the pelvic floor issues because the pelvic floor is also connected to our transverse abdominis. So for those of us who are having leaking issues, I have a pelvic floor. She's a pelvic floor physical therapist. She has her doctorate in it. Her name is Dr. Lexi. She oversees our ladies in our 8-week core challenge, and she helps me in our weight loss program as well. But she talks about how you have a pelvic floor issue if you're leaking, if you feel a lot of vaginal heaviness, or just like things are falling out of there. Now, a lot of that stuff is part of your deep core. It's like all connected. And so she'll say, hey, we have to tighten your core because that's part of it. And here's how you know why. You want to know another aha moment, like I was just talking about the back and how the back pain is related. Here's how I'm going to show you that your pelvic floor is connected to your deep core muscle or your abs, okay? Like if you look at my little suit here to make me look so silly, all right? You see the abs there. You see how the muscles are kind of going down. Like I'm not trying to be gross here or anything, but the muscles are kind of going down. These ab muscles are connected to our pelvic floor. And if we're having leaking issues, a lot of times they're connected. Okay, so here's a little exercise right now that you can try to show you, to prove to you, to convince your mind that your pelvic floor is connected to your deep core and also helps to bring those abs in. Right now, I want you to do a really strong Kegel. And by Kegel, this is what I want you to imagine that you're doing. Pretend as though you are picking up a marble with your lady parts and you're trying to pull it up into your stomach right now. Okay? Try that again. I want you to pretend as though you're picking up a marble with your lady parts and you're trying to pull it up into your stomach. If you feel your lower abs and your abs contract, I want you to say me in the comments. I want you to say me in the comments. If when you do a nice tight Kegel, you lift up, pretend like you're doing a Kegel, pretend like you're lifting up a marble and pulling it up into your abs. Okay? You're picking up a marble and you're bringing it up into your body. Yes, I see me, me, me. Okay, awesome. So if you feel a lower ab contraction, Josephine, I see you say me, Michelle, me, user 70, yes, me, 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 me. That is because the pelvic floor is connected to your abs, to your deep transverse abdominis muscles that we work on in my 8-week core challenge and the exercises that I have. We have to work on the pelvic floor in conjunction with your deep core muscles. So that's why it's a complete program. People ask for exercises. Like, it's not that simple for me to just explain everything to you here and do the exercises. That's why I have some free exercises for you to try, and that's why I have a whole program, because all these things are connected. Like, all these things are connected, and we have to address it as an organic whole for there to really be some serious success. I see me, 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 me. Yes, you felt it so hard, user 859, that your abs actually cramped. I love that. I love it. And for some of us, we may not feel it. Sometimes we have either a weak pelvic floor, so weak, or deep core abs that are so weak that you don't feel that connection, but that's what we work on. We work on restoring that connection. We work on tightening all those muscles and bringing it all back together because it's all connected, okay? So if you're having those issues, remember, it's not just an aesthetic, you're so vain. It's not that. And even if you are, even if you just want to have your body back and just feel a little tighter, feel a little more comfortable with what you're wearing, you don't have to feel like, okay, what can I wear that has my stomach and that makes me feel more comfortable? Like, you don't want to have to feel like you have to just wear sweats every day. Like, I talk to moms all the time, like literally every day, and I hear that so much. Like, I don't even know what to wear. I don't even want to go out anymore because I don't know what to wear. I hate looking pregnant, and I'm not pregnant. You know, all these things. That's important too. Like, if that's important to you, it's okay. There's nothing shallow, I don't think, about that. Like, that's my opinion. I don't think there's anything shallow. But if it makes you feel better and you want to let people know, like, I'm not shallow, I just want to be functional, and I just want to have a tight core so my back is tight, my pelvic floor is tight. I don't have to feel like when I laugh, sneeze, cough, I'm going to pee myself, or when I jump, I'm going to pee myself. Like, those are legitimate issues, and those are things that we don't have to live with. And that's why I have my program, is because we shouldn't have to live. I didn't want to live like that anymore, and that's why we can work on ourselves. 15 minutes a day is all it takes. 15 minutes a day is all it takes to start restoring that deep core strength and get that function back that we want.